Treatment over cure model. You know, empty hospital beds and healthy people don't create wealth. Before we begin, please like and subscribe to this video and channel. And be sure to hit the bell notification so you can view our future videos. Back to our video. So, what is the treatment over cure model? Well, it is the idea that the healthcare system focuses on managing chronic conditions with ongoing treatment, generating continuous profits, instead of pursuing cures that may eliminate the need for long-term prescriptions. Although there may be some parallels of people being indentured servants to the medical system, it's more like we are a perpetual patient, where we are kept in a prolonged state of care, where managing the symptoms, rather than curing the illness, seems to be the goal. Let's meet somewhere in between. How about medical servitude? This is where we patients are stuck in a long-term dependency on the healthcare system, not unlike indentured servitude, but without a clear path to freedom or resolution. This unclear path to resolution is intentional. Empty hospital beds and healthy people don't create wealth. Do you get it? Wealth and power is their goal. I don't necessarily mean this is the goal of your nurse or phlebotomist, or even your primary care physician, but it most certainly is the goal for the hospital administrations, medical specialists, BlackRock, Vanguard, State Street, Johnson & Johnson, Pfizer, etc. The medical system has this Pavlovian effect on us. They keep giving us drugs, we think we're getting better, we believe our dealers are honest and sincere, and we keep going back for our fix. Only to find out that our blood pressure hasn't gotten better, I still have type 2 diabetes, and my LDL isn't going down. We humans are their hamsters. We are smart enough to realize that something doesn't pass the smell test, but we are dumb enough to keep getting on the hamster wheel and taking them. By the hamster wheel, I mean the continuous nodding of our heads and saying yes every time our physicians and the system prescribes a new drug. Let's look at a few examples so we can put this into better context. Here are 5 examples of medical servitude, where patients might feel trapped in long-term dependency on the healthcare system, often for profit, without reaching a permanent solution or cure. 1. Chronic pain management with opioids. Example: patients with chronic pain conditions like back pain or fibromyalgia are prescribed opioids for long-term pain relief, often leading to dependency without addressing the root cause of the pain. Over time, they may require higher doses due to tolerance, while alternative treatments like physical therapy, dietary changes, or holistic care are underutilized. Rarely will doctors subscribe to their patients using holistic approaches. Servitude aspect. Patients become reliant on prescriptions to manage pain, while pharmaceutical companies and healthcare providers profit from long-term opioid sales without seeking a sustainable solution. Diabetes management with medications. Patients with type 2 diabetes are prescribed insulin or medications like metformin to regulate blood sugar levels, but are rarely given access to robust lifestyle programs that could lead to remission. Instead, they remain on medications indefinitely, even though significant lifestyle changes might reverse their condition. The emphasis on lifelong medication over addressing diet, exercise, and holistic care creates a dependency on the healthcare system, benefiting pharmaceutical companies. We recently had a wonderful testimony from a pastor here in Muskogee who was able to lower his numbers, weight, and blood pressure just by using Gymnema sylvestre powder. Antidepressant dependency for mental health. Patients with depression or anxiety are often placed on SSRIs or selective serotonin reuptake inhibitors or other antidepressants for years or even decades. While these medications may manage symptoms, they can cause withdrawal or side effects when patients try to stop using them, keeping them reliant on the medication. Patients may never be offered alternative therapies like cognitive behavioral therapy, or CBT, or lifestyle interventions, leading to long-term use of medications, benefiting drug manufacturers without providing a cure. High cholesterol management with statins. Patients with high cholesterol are frequently prescribed statins, often for life, to manage cholesterol levels and reduce the risk of heart disease. While statins are effective, they don't address the lifestyle factors like diet and exercise that could potentially reduce cholesterol levels naturally. Long-term reliance on statins provides pharmaceutical companies with a steady revenue stream while leaving patients dependent on the medication instead of focusing on lifestyle interventions that could offer a more sustainable solution. Autoimmune disease management with expensive biologics. Patients with autoimmune conditions like rheumatoid arthritis, Crohn's disease, or psoriasis are often prescribed expensive biologic drugs to manage their symptoms. These medications, such as Humira or Enbrel, reduce inflammation but are extremely costly and usually required for life without necessarily addressing the underlying causes of the autoimmune response. The patient becomes financially and physically dependent on these drugs to control symptoms, while alternative approaches like diet, stress management, or immune system regulation therapies are rarely prioritized, creating long-term profit for pharmaceutical companies. These examples illustrate how the treatment over cure approach and medical servitude trap patients in a cycle of dependency on medications or treatments. This system benefits healthcare providers and pharmaceutical companies, but often leaves patients without options for addressing the root cause of their conditions or achieving lasting freedom from their treatment. So what can you do? How do you get off the hamster wheel? First, you have to realize that not all allopathic approaches are bad. In fact, as a society, we have made tremendous strides by use of allopathic medications. Secondly, you need to educate yourself. Become the subject matter expert on your health issues. Read, and read some more if you have the time. There is no better investment than your health. It's been said that time is an asset. Once you have it, you'll never get it back. So why not use it wisely and read about the holistic approach you may be able to take so you feel better and live longer. Lastly, talk to your doctor about the alternatives that you've researched and, most importantly, why you want a more holistic approach to your healthcare. Once he or she realizes that you have done your homework, they may be more apt to listen to your argument. You can learn more at morningsongorchardandnursery.com. At Morning Song Orchard and Nursery, we have over 430 inventory items, which includes over 160 botanical herbs, over 60 blended teas, spices, and over 60 supplemental powders. Our newest items are our 100% grass-fed beef liver pieces called Charlie Chunks. Charlie Chunks are small, bite-sized pieces for your fur friends. Additionally, we just formulated and have for sale our very own proprietary mushroom coffee blend. Mycovita has chaga, reishi, lion's mane, and cordyceps mushroom, as well as turmeric, ginger, and Ceylon cinnamon. A powerhouse of a blend with a down-to-earth price and taste. You can also visit us on Facebook at Morning Song Orchard. We're the ones with the pretty red bird. See you soon.